Have you recently been diagnosed with POTS and not sure what to do? First off, what is it? POTS, or Postural Orthostatic Tachycardia syndrome, is a complex blood circulation disorder that causes rapid heart rate, dizziness, lightheadedness, and sometimes even fainting from sitting down and standing up too fast. Most people feel better in a laying down position because there's more blood circulation going up to the head. And when they stand up, they're not getting enough blood flow to the brain. When you have an upper neck misalignment, what we call in this office a foundational shift, it can disrupt the blood flow up to the brain. It can compromise the vertebral artery, which goes right through the bones in the upper neck. And when that upper bone misaligns, it can cause some lightheadedness, dizziness, and fainting. Now, this is a complex disorder. You should have a team of specialists involved with POTS, but one of the most overlooked aspects in this syndrome is the upper spine. We take advanced x-rays in our office to visualize how the upper neck is misaligned. We then give a very precise, unique adjustment designed specifically for you. There's no twisting or pulling involved with these adjustments, and they're designed to hold in place for extended periods of time. So you get the proper blood flow up to your brain, and the lightheadedness and dizziness dissipate, and you get your life back. Comment below with your city and zip code. We're trying to find a doctor nearest you. Thank you.